What's the first thing you think about when a dentist says you need a root canal? Are you constantly thinking back to all of the times someone told you a horror story about their root canal procedure? Do you find yourself thinking, but my tooth doesn't even hurt? Why on earth do I need a root canal? Hi everyone, I'm Joyce the dentist. I've treated thousands of patients over the years, and if there's one dental procedure that people misunderstand the most, it's definitely root canal treatment. Today I'm going to break down what a root canal is and what the procedure involves. That way, if you desperately need a root canal, you know exactly what to do. So first things first, what is a root canal? A root canal is a dental restoration that isn't limited to the outer surfaces of your tooth like a crown or a filling. This treatment extends down into the root, filling the hollow nerve chamber after an abscess or dying nerve is removed from the tooth. When you get a root canal, it seals off the inside of the tooth so that new bacteria can't re-enter that space through a cavity or a crack. Without this treatment, the tooth would just start to dissolve or erode from the inside until there isn't enough root structure to support it any longer. It would either break off or have to be extracted. Getting a root canal buys you a lot of time because it preserves your natural tooth and helps you avoid an unnecessary emergency tooth extraction. It can also save you money because you're not having to turn right around and replace an extracted tooth with an implant or a bridge. If you do need a root canal, it means your tooth is past the point of repairing with a filling or a crown. But as you plan for your root canal procedure, you can expect the appointment process to be similar to other dental work you've had. First, your dentist will get a nice clear x-ray of the entire tooth. Some teeth have multiple roots, like molars, so it's important for your provider to know how many there are and to make sure there aren't any abnormalities, such as roots that are too narrow or curved, for example. Next, your dentist will completely numb your tooth and the area around it. The local anesthetic will deaden the nerves so that you don't feel any type of sensation. However, you can feel little pressure, but it shouldn't hurt. After your tooth is completely numb, your dentist creates a small hole in the top of the tooth. Usually this step is paired with removing active cavities or damaged enamel in that space. Once the nerve chamber is visible, your dentist uses extremely small, tiny files to clean the inside of the chamber and the narrow canal that extends through the length of each root. Again, you'll be completely numb. As these nerves are removed, the source of the tooth pain is as well. After the canals are completely cleaned out, your dentist will usually place some type of medication deep down inside them or use a special sanitizing solution to remove any remaining bacteria. They're basically disinfecting the inside of your tooth. Finally, filling material is inserted inside of the root chambers, filling them from bottom to top of the tooth. And this material seals off the chamber and prevents food, saliva, or bacteria from getting back inside the middle of the tooth. At this point, the inside of the tooth is protected, but the top portion of what we call the clinical crown is susceptible to break and cracks, since the tooth no longer has a vital nerve and blood supply. To protect the tooth and help it last as long as possible, we almost always put a full coverage crown over the top of it. The crown or cap acts like an extra layer of reinforcement, so you can continue biting down and chewing on things without worrying about the non-vital tooth breaking or giving out. Usually, your dentist will put a temporary crown over the tooth right after your root canal is completed. The final crown is typically ready to bond into place about 2 weeks later. An important thing to remember about root canal treatment is that the nerve responsible for causing any tooth pain is no longer there, so your procedure basically eliminates the source of any future toothaches. That being said, you might still have a little tenderness in that area, especially where the local anesthetic was injected or from having your mouth propped open for a few hours. You can also help relieve them with a cold compress or some over-the-counter pain reliever. Investing in a root canal is the best way to preserve a dying or abscessed tooth. Avoid an extraction and expensive tooth replacement, and keep your bite functioning normally. Just like getting a filling or other dental work, your root canal procedure is a straightforward process where your dentist will numb your tooth, keep you comfortable, and treat the area to help your natural smile last as long as possible. So if you've been avoiding a root canal, now's the time to talk to your dentist about your options. Smile smarter, everyone. I'm Dr. Joyce. I'll see you next time. Bye.